So I will be speaking on the response of the Nigerian Solidarity Support Fund in the event of COVID-19 in Nigeria, how the private sector mobilized resources and strengthened the health system. So that's my bit for today. I'm Dr. Fejiro Chinye-Nwoko, as she said, and I'm the CEO of Nigerian Solidarity Support Fund. So the fund, a brief history of the fund. The fund was formed as a partnership between Global Citizens and the Nigerian Sovereign Investment Authority in 2020 as a result of the weak health system that we have, and in order to support the most vulnerable, strengthen the health system, and to reskill the Nigerian youth for a new Nigeria post-COVID-19. Our vision is a Nigeria where organizations innovatively collaborate to improve health outcomes of vulnerable people and underserved communities. And our mission is empowering organizations through innovative approaches, partnerships, and collaborations to improve the health outcomes of vulnerable people and undeserved communities. Our focus here is to improve healthcare leadership and governance for better service delivery, and a focus on routine immunization and maternal and child health. We have three core objectives, and one is to enhance partnerships and collaborations with other non-for-profit organizations, the government, private sector, and individual donors. Our second objective is to empower health-related non-for-profit organizations and government institutions. And lastly, we want to improve health outcomes for vulnerable people and underserved communities in Nigeria. And how did we go about this? In 2020, when NSSF was inaugurated, we had the Abuja Declaration, Nigeria attested to the Abuja Declaration to allocate 15% of the annual budget to health. However, in that year, they have only disbursed 4.7%. And so this left the country in a very vulnerable position, added to the impact of the COVID-19 pandemic on the country. As COVID-19 pandemic was declared by WHO on March 11, 2020, as of December, Nigeria has had over 87,000 confirmed cases of COVID and over 1,000 deaths, according to WHO. Although vaccines were rapidly developed, Nigeria's response was impeded by limited resources. The National Primary Healthcare Development Agency, which is the NPHCDA, they had the government agency responsible for improving the coverage of routine immunization, childhood immunization, and strengthening the primary healthcare facilities. And so when the COVID-19 vaccine came into use, as at 2021, they set a target to vaccinate 70% of Nigerians, eligible Nigerians, and that was amounting to over 100 million Nigerians to be vaccinated by December 2022. As of June 2021, only 3% of that number have gotten at least one dose of vaccines, and this presented a threat to the goal that the National Primary Healthcare Development Agency had set for themselves. The low uptake was attributed to funding gaps in country for mobilization of vaccines to different communities, and especially the hard-to-reach communities in Nigeria. And so there was limited funding for that. And there was also challenges with vaccine hesitancy and accepting that the vaccines were necessary to stop the spread of COVID-19 at that time. So what we decided to do at that point was to partner with the National Primary Healthcare Development Agency to move vaccines to the last mile. And we did that by collaborating and raising resources from the private sector to be able to mobilize vaccine delivery in states that had to reach communities. NSSF did that, and initially we set a 6-month target of helping to vaccinate another million. At that time, the country had only vaccinated 1 million people, and so we committed to doubling that number, getting 1 extra million people vaccinated within a 6-month period. What we raised funding for was to first address the vaccine hesitancy issues in the states that we were targeting, is to improve waste management and to improve the performance of the healthcare workers that would give these vaccines to the different people in the communities. So we had to go to the different states and develop materials, advocacy materials that were used for the people. In addressing vaccinations, we had to use existing communities such as the marketplaces, the religious places like the mosques and the churches. We had to go to schools, tertiary institutions that had individuals that was above the age for COVID-19 vaccine. We used the existing communities, distributing these materials and speaking to them. We used also traditional media, which is the television and radio, came up with jingles to be able to educate people and demystify all the myths around COVID vaccine and how it was how it has been perceived in the community. And so that's how we went about it. So first is that we collaborated with Global Citizens and the NSIA. We collaborated with them to be able to come up with an idea of raising funds and catalyzing donations for Nigeria. We also sought local ownership by going. We had a visit with the Vice President of Federal Republic of Nigeria at 2020, and we undertook. We had a discussion. We had a roundtable discussion with all the high-profile politicians in Nigeria. We wanted them to see NSSF as an intervention that would help the administration, and rather than an intervention that will work on its own silos. So we had those meetings, and we had a consensus that this was necessary to be able to improve the outcomes that we already had. We also had a very active board. At the time, our board was made up of the board of Global Citizens in Nigeria and the board of NSIA, which is the Nigerian Sovereign Investment Authority. And our board members also had friends, and they had acquaintances, they had business partners that they've done business with over 20, 30 years, and they were able to bring them to the table to discuss what we wanted to do as a fund and how we wanted to use the funds and in what transparent way we wanted to use the fund. We also had to develop our own accountability mechanism, because we know that the donor fatigue that we experienced from especially the private sector in Nigeria was as a result of poor accountability mechanism on how funds are used by the organization. So we created a watertight accountability mechanism, which was in 3 different ways. First is that we reached out to very notable institutions such as KPMG to be in charge of our external audits, and they graciously agreed to audit us at no charge. So they came in on board to audit the activities, the financial activities of the fund. We also, because we also worked through grant administration, reached out to PwC to come help us conduct grant administration in a way where grants are given to CSOs and implementing NGOs in a very transparent manner. and would not allow for us to give grants on without to organizations that were not fit for purpose. And so we would the PwC came on board to scrutinize the organization, make sure that they have the existing systems that was necessary for grant utilization. We also had to have monitoring and evaluation / impact assessments done by an external body to help us with a transparent record on our impact so far. Also, we also got KPMG to be able to do M&E for us and for the programs and the projects that we do. Again, we also built credibility in the sense of that we had the fund, the Nigerian Sovereign Investment Authority being our fund managers, and they have had a reputation of financial transparency. And so every fund we receive goes to our account to them, and they disburse to the grants, the grantees that we have co-identified, and then they also track the performance of this grantee, and so that we have our funds warehoused in a safe place and they're used for the purpose for which the fund was created. And lastly, the additionality bit was that we said that instead of running programs on a silo, we would work with the government to make sure that we run programs that we augment the programs that the government is already running. We didn't believe that if we work in parallel, that we would achieve synergistic effect. And so we decided that we will only fund programs that governments have started based on need, and that we would augment those programs. For the COVID-19 vaccination campaign, at the end of 6 months, we had trained over 12,000 healthcare workers on immunization program and how to organize the proper immunization outreach in their communities. We had reached over 12 million people in the communities, really educating them on the benefits of the COVID vaccination and how and the safety of the vaccination, and really just demystifying the facts and the myths around COVID-19 vaccination. And as at December 2021, we had contributed to the increase of vaccination beyond what we had set out to achieve. We got 4.9 million people vaccinated within 6 months, and that was great success for the fund. Besides the COVID-19 vaccination, we also gathered the private sector to increase the advocacy role of the youths in Nigeria. One of our core objectives is to reskill and retool Nigerian youth to be relevant in the post-COVID environment. And we felt that the Nigerian youth being digitally literate and having a smartphone with them would be able to lend their voice to improving healthcare outcomes in Nigeria if we work out a way to gather them together, talking about topical issues at different times and incentivizing those who perform the best amongst them. So we developed this We Nigeria campaign. We created it specifically for youth empowerment and using advocating for youth advocacy. And this campaign mobilized, inspire, empower, and upskill the Nigerian workforce for this era. We've done this campaign 2 years in a row. We had the first one in 2021 and the second in 2022, and we have mobilized over 1,200 youths. We have given prizes, winning prizes and funds. We've given winning prizes and funds to 150 Nigerian youths in our capacity building part of the campaign. We'll have a capacity building for different purposes. So for the for the first campaign, it was a photography campaign we had. We had a photography campaign where we galvanized the youth to take pictures on the impact of COVID-19 in their environment and how people were responding to the COVID-19 pandemic through the lens of the camera. And we encourage youth to use the cameras on their phone to tell a story, a picture story. We had that auction. We had a collaboration with Bonhams UK and had that virtually auctioned, and prizes were given to the winning pieces for that campaign. So we second We Nigeria campaign it was a writing competition, and we asked them to write about the state of the health system in Nigeria, and from their own lens as youth, what they thought was would be a good place for the health system to come to, what they're expecting of the health system in Nigeria, how they expect that the health system will treat them, or we address issues that they have, health issues that they have. And we had youths participating, writing, and we published that as a book, which we can see in the pictures. We published the stories. We had fiction writing. We had true, real stories. We had poems, we had poetry, we had different type of writing and published in the book, and very interesting to get. And then, of course, we built the capacity of some of the winners of this group. So 78 so far. We have had capacity and training for them. And we have been able to put 4 of these winners in a 6 months paid internship with a notable organization as well. So that's what we've done in youth empowerment. So far as NSSF, in terms of resource mobilization, that's because that is one of the core functions of NSSF. We've had four fundraising events in Nigeria, galvanizing the private sector, individual donors and corporate donors. We raised over 1 billion naira in 2 years. We have had different collaborations with media partners, media and print partners that have come to collaborate and tell the story of the fund and the impact that the fund is making. In terms of relationship building, we've had over 15 stakeholder meetings to refine and decide on projects that we will do. Like I said, we are in the spirit of additionality, adding to projects that are already existing. So we have several stakeholder meetings throughout the years. We partook in the National Emergency Routine Immunization Coordination Center meetings, which is being organized and coordinated from the federal level. We've had 2 We Nigeria campaigns, which have impacted over 1,200 youths, and we've had 5 fireside chats. We have a quarterly roundtable discussion where we bring experts in the public health space and governance for leadership for healthcare, as well as the media agency, to discuss on ways that we can strengthen the health system. And participation and the reach for this advocacy roundtable conversations has reached over 9 million people in Nigeria. On health system strengthening, we've helped to vaccinate 4.9 million Nigerians with COVID-19 vaccines. We have published 1 policy brief, and 2 peer-reviewed papers have come out on the works that we have done so far in reducing COVID-19 through advocacy, increasing and reducing vaccine hesitance, and increasing the COVID-19 vaccination uptake. And currently we are running the SORIS project, which is to strengthen governance and governance and accountability for routine childhood immunization in Nigeria. And again, we're doing that with the government agency. What is our in terms of our lessons learned so far, the greatest lesson we've learned is that no matter how much good work you want to do, doing it with other organizations that have the same mission would give you impact at scale. So we've learned partnerships and collaborations to get a greater impact in Nigeria. Nigeria is a country of over 200 million people, and Nigeria is divided into 36 states, which is large. And so partnership with private organizations to bring out funds for the health projects, partnerships with the government to identify projects that are burning issues and priority for the country, partnership with other non-for-profit organization which play in that space, which play in the health strengthening space. We have partnered with them, as well as partnerships with grants making organizations. Additionality has also been one of our lessons learned, that instead of running projects in parallels, we come together and add to what is already existing. Data has been one strong thing that we've used to identify projects, and we will continue to use to identify projects where we can identify using data the gaps that exist and ways that we can combat those gaps and close those gaps. And also public-private partnerships. We have been able to work well with both the private and the public to give us the results that we've had so far. Sorry. Well, I think that's the end. I don't know if there are any questions.